Hi everybody, I'm Mark McIntosh, and let's be honest, most of us are afraid to go to the dentist. But today there are different options available to help those of us who struggle with dental fear get through our dental visits. And if you are by chance afraid of going to the dentist, there are 4 questions you should be asking. And today we're joined by Dr. Charles Bartoz, the senior dentist and owner of Bartoz Dental. He's been practicing dentistry here in Denver for more than 30 years. Dr. Bartoz, thank you so much for being here. It's great to see you.
Nice to see you, Mark.
All right, so let's talk about this. What is one of the things I really want to find out about, and I'm sure so does everybody else, what is no fear sleep dentistry?
Well, the number one reason people do not go to the dentist is because they're afraid. But it's interesting. They're afraid of going, but they're also afraid of not going. Because if they don't go, they're afraid things will get worse.
Yep.
So usually what happens is people allow their fear to keep them from going until something really, really hurts where they have no choice. Some people are so afraid they even endure that pain and get past it until the point where, let's say, the infection spreads to the bone and can actually create a life-threatening or certainly health-threatening incident. Now, no fear sleep dentistry is sedation dentistry. Sedation dentistry gives the patient the ability to either take a pill or have an IV line set up, which can allow them to go to sleep before their dental treatment is started.
You're asleep and you're getting your dentistry done?
Correct. And then when they wake up, your dentistry is done. Now, this is not general anesthesia. This is sedation dentistry. And it's kind of like getting on a plane for a long flight and having the wheels go up as you take off, falling asleep, and waking up at your destination. Isn't that always nice when that happens when you're flying?
If we could only fly like that.
Exactly.
But that's how our visit to the dentist could be.
Exactly, like a time machine.
Oh my gosh.
You have no recollection of the dentistry being done. All you have is the benefit at the end.
Oh my gosh. And so, sedation dentistry, what types are available? You mentioned a couple.
Well, basically, the types that we do at Bartoz Dental are oral sedation and IV sedation.
Okay.
Oral sedation is something that we offer for major treatment at no additional charge. IV sedation, there is a charge for it because we do keep a second doctor in the room. So that's really the differences. The oral sedation, we can get slightly deeper sedation with the IV, but for most people, the oral sedation is all they need.
Just take a pill, go to sleep, wake up, your dentistry is done. How can we ensure that this is safe?
Well, first of all, our state board has specific requirements that certify the dentist to either do oral or IV sedation. And one of the requirements that they have is they come in and they inspect your office and make sure that the office is satisfactory for this type of sedation. Okay. But the other thing is that we keep a monitor on even oral sedated patients. Many doctors who aren't doing it, quote unquote, according to specs, will give the pills and not really have the patient monitored. And while this isn't particularly dangerous, it is certainly not the proper way to do it. So if you're having sedation dentistry, you should have a heart monitor, you should have an oxygen monitor, you should have your blood pressure and pulse being monitored consistently. And it really, I'll tell you what, years ago I didn't have the monitor, and ever since bringing the monitor in, it's given me the peace of mind of knowing the exact state that my patient is in, and it should give our patients peace of mind to know that they're being properly monitored.
Yeah, for anybody watching this who says, man, I want to learn more about this, how could they get a free consultation?
Well, we understand at Bartoz Dental that stepping into a dental office in and of itself can make your heart race. And what we want to do is, even when you're not having your dental treatment done, we want to create a warm and welcoming environment for our patients. So, and we understand that's going to require a significant emotional commitment. I mean, because you have to overcome your fears just to walk in the doors. But we also understand that there will be a financial commitment. And it's very important that you feel good about the relationship before you start. So what we do is we offer a free consultation. I take a look in your mouth. No, I don't do a thorough exam at that point in time, but with the 31 years experience I have, I can get a good feeling for
Yeah, what's going
what
on.
might be involved,
Right.
and then we discuss what might be involved, and you have the opportunity to meet me, to meet my staff, to see the way we treat people, and see if it's right for you.
Mm-hmm.
If you're not feeling comfortable with us, that can happen. No harm, no foul.
Right, right.
It doesn't cost you anything to come on in. But in most cases, people really do feel comfortable with us.
Yeah.
I mean, we treat people really, really well. And we really do care that we care about your fears, and we want your visit to be pleasant or at least neutral. We don't want it to be quote unquote torture to you. So we're going to do everything possible to make you feel good about coming to us. That's our goal. If that sounds like it's a worthy goal and you want to come on and see us, again, we offer a no-charge consultation where you can get your questions answered without any financial risk whatsoever.
Dr. Bartoz, thank you very much. We appreciate that.
My
All
pleasure.
right, for more information or to schedule a free consultation with Dr. Charles Bartoz and Bartoz Dental, all you have to do is visit denverdentist.com, or you can pick up the phone and call 303-731-4851. Bartoz Dental does not accept Medicare and Medicaid. The number one more time, 303-731-4851.